So,
In situations like that, you are more likely to expect some awareness.
so trauma patients.
Trauma patient, there are certain categories that are more likely. Trauma patients, patients having heart surgery, because some of those patients are quite sick. There are times during the procedure where they may not be able to tolerate a full general anesthetic. Also, patients who are very sick from some other cause, for example, overwhelming systemic infection. Patients such as that often have blood pressure problems. When they come for emergency surgery, we are often not able to give them a full anesthetic.
Fragile patients.
Fragile, very old, very sick patients would fall into that category.
And patients with some specific medical conditions, like you said, would make it better to keep them lighter.
Right, exactly. And there are certain patient categories, patients who are on high doses of sedative medications, for example, patients who would take, for example, a lot of Valium or Librium, or high doses of psychiatric medicines.
Right.
Those patients are more difficult to anesthetize and take more anesthetics. People with alcohol abuse, even smokers, require more anesthetic in general.
Recreational drugs.
Recreational drugs would definitely fall into that. Another reason not to do recreational drugs, one of the many.
One of the things I wanted to ask you was, after something airs like Grey's Anatomy, when that's such a focus of the storyline,
Sure.
how does that impact your job? And
Not well.
I can imagine. Do patients come in and say to you, now, am I going to be asleep? I just saw this on Grey's
Absolutely.
Anatomy.
Absolutely. So in a way, we hate to see those shows on the TV because they do seem to overemphasize the issue. And yet, on the other hand, it does happen. So, you know, in a sense, we have to welcome those questions too. In surveys that have been done, approximately half of patients will tell you that anesthesia awareness is a concern of theirs. So it's something that we talk about very commonly. We try to reassure people that it is, in fact, unusual, that it does happen, in the same sense that if you decide to fly from Washington to Los Angeles, it's, in general, it's a very safe proposition. But on the other hand, every now and then someone doesn't make it from Washington to Los Angeles.
Are children susceptible to anesthesia awareness?
They are.
Well?
They are. It's a little bit more difficult with children because, especially with young children, the reporting is more difficult. The kids are less likely to be able to articulate what they have experienced. Kids often fantasize anyway, and if a child tells you that he's experienced something like that, you're not 100% sure, but yes, it can happen, and we have to take any complaint seriously.
I'm sure that one question that people who are watching and are not familiar with anesthesia may be interested in knowing an answer to is, if people are aware of what's happening to them, they're feeling somebody making an incision, why can't they communicate that to you?
Sometimes they can, if a patient is very lightly anesthetized, if they're too light, as we would say, and there is some awareness. Sometimes a patient can communicate it by moving. There are other times when we use paralyzing drugs. Paralyzing drugs are used for several different reasons during a general anesthetic. One is when we first put a patient to sleep, in order to facilitate putting the breathing tube in the lungs, we paralyze almost every patient that we do that for, in which case, if there was awareness, the patient would not be able to move. And also during an operation, maybe 15–20% of the time, depending on the type of surgery. For some surgeries, very commonly, we use paralyzing drugs to facilitate the surgical procedure, to make it easier for the surgeon to carry out the procedure, to relax muscles that make it easier for the surgeon. So in that situation, if a patient had some awareness, he or she would be unable to move or to nod their head or to blink their eyes or to do anything to communicate it. It's not terribly unusual when a patient is asleep. if they're a little bit too lightly anesthetized, for them to move a little bit, and usually without any awareness at the time. But if a patient moves a little bit, that tells us that we need to do something, usually give more anesthetic. If a patient is paralyzed, which, I mean, that's an awful term to use, but if their muscles are relaxed, they're less able or maybe unable to do that. I should say that we only paralyze people when it's really important for the surgical procedure. We don't do that lightly, and we realize that when we paralyze a patient, that takes away one of the ways that we can tell that there is awareness going on. So we only do it when we absolutely feel it's essential.
You know, all those years I work in the operating room, days I spent with you and nights, it was always stress to us to be very quiet when the patient's going to sleep and be very quiet when the patient's waking up. Do you think that some of what patients hear as they're going to sleep and as they're waking up, that some people assume that that's anesthesia awareness?
Yeah, absolutely. We often will hear after the fact that a patient remembered, well, not often, but occasionally we'll hear that a patient remembers things that happened. When we go to talk to the patient, it turns out that what they really remember is voices around them while they're going to sleep, or voices around them while they're waking up. We try to be, as you point out, we try to be quiet, we try to be considerate, but there is almost always some conversation going on in the operating room as the nurses and the doctors get ready for the surgery. And when the patient is waking up, there similarly is conversation going on. We try to always, when a patient is waking up, we try to tell them repeatedly, you are waking up, your surgery is over, so that there's no confusion. But some of the time what is taken as anesthesia awareness is really just that time either before the patient is going to sleep or right as they're waking up.
Is it difficult for you as an anesthesiologist? As you said, this doesn't occur very often, but how difficult is it to recognize that something like this is happening?
Sometimes, well, typically what we always followed was vital signs, pulse, blood pressure, oxygen levels. And as a patient gets lightly anesthetized, or if there begins to be some awareness, typically the patient's heart rate will go up, the blood pressure will go up, and that's a sign that we need to increase the level of the anesthesia. And that is true to some extent. It is not always true, however. The blood pressure and the pulse don't always go up when there is lightening of the anesthesia or possibly awareness. Partly we don't understand why that is, and partly so many patients now are on, for example, blood pressure medicines, which help to keep the blood pressure and the pulse down. If you're on a beta blocker, which so many people are on, that tends to keep the blood pressure and the pulse down. So we've lost, with some patients, we've lost one of our guidelines for anesthesia awareness.
What specific types of monitoring devices do you use during the surgical procedure?
Well, the ones that we've just talked about, blood pressure, pulse, oxygen levels. There are also now some brainwave monitors that have been developed over the last few years that have been developed and marketed heavily as devices to prevent anesthesia awareness. One of these is called the BIS monitor. Another is called the entropy monitor, and we have these. And there were several studies done when they first came out, studies that, as you might suspect, sponsored and run by the companies that make these monitors, that showed that using the monitors decreased the likelihood, not totally eliminated, but decreased the likelihood of anesthesia awareness, because you could see when a patient was light and deep in the anesthetic. Let me just say, backtrack a little bit. These monitors give you a numerical score anywhere from 0 to 100. They're based on the EEG, or the brainwave test, and 100 is totally, fully wide awake. 0 would be the deepest of the deepest of the deep anesthesia. And what we have been aiming for with those monitors is to keep a patient's number between, say, 35 and 55, somewhere in that mid-range in which a patient is safely asleep, not too deeply asleep, but asleep enough.